So first thing I want to do when I arrive on scene, there's a baby lying on the floor. It'd be kind of weird, so you want to ask if this is anybody's baby, because you're going to have to ask for permission before you help. I'm checking for dangers to make sure I don't get hurt, or the baby doesn't get hurt anymore. So I want to also shout out, do a little history check. Did anybody see what happened? In this scenario, nobody responds. So I'm going to check for the baby's consciousness. So you want to shout near the baby, 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 baby. You can't really tap the shoulders or pinch the trap, so in this scenario for an infant, which is under the age of 1, you're going to tickle the toes, pull its legs to see if you get any reaction. In this scenario, I don't get any reaction, so I'm going to check for breathing as soon as possible. So, head tilt, chin lift. It's a little trickier than an adult or a child. You can't pull the head back too far or have it not open far enough, because you can imagine the infant's airway like a straw. If you pull back too far in a straw, the airway is closed. If it's not open enough, the airway is still closed. So you have to find a happy medium. It's called a sniffing position. I don't know why it's called sniffing, doesn't really make much sense. But you want to have the chin and the nose of the infant parallel to the ground. So chin and the nose of the infant parallel to the ground. So that's going to be just about here, and there's my perfect open airway. Right, so I'm going to check for breathing for a maximum of 5 seconds. 1, 1000, 2, 1000, 3, 1000, 4, 1005. I'm looking and listening and feeling. So I'm feeling the ear, feeling inside the ear, listening for the breathing, and I'm looking at the chest to see if it's rising or falling. I'm checking for normal breathing. I didn't get any in this scenario, so I'm going to ask somebody to go call 911. Hey, you in the black, go call 911. I have an unconscious infant that's not breathing. Bring an AED and somebody trained to use it. Do you understand? I get the okay. If I don't get the okay, you can send somebody else to do it. So in this scenario, the bystander understands. So I want to expose the chest just like for an adult and a child. And I'm going to do it just below the nipple line. So the easiest way to do that, 3 fingers, top finger between the nipple, let go of the top finger, and there you go, is a perfect spot. So I'm going to do my 30 chest compressions here. I'm pushing down 1/2 to 1/3 the depth of the chest of the infant. That applies for an adult, infant, and child, is all of them are 1/2 to 1/3 the depth of their chest. I don't like using inches because you don't carry a ruler with you. And we're doing a 30 chest compressions. The tune is staying alive, which is about 100 to 105 beats per minute. You don't want to go slower than 100. So let's say that's 30. So again, I want to ventilate now. So airway open, chin and the nose parallel to the ground. I'm going to give it a puff. How much is a puff? Just enough to blow out a candle in front of your mouth. So I'm going to seal my lips because I don't have a barrier device. I'm going to seal my lips around the infant's mouth and the nose and give a puff. Puff. Chest rises. Again, puff. You don't want to give a full breath. It will be too much air. And back to my 30 to 2. I'm going to do 30 chest compressions with 2 fingers and 2 puffs, non-stop, so I can also do it. I got a free hand here. That hand can keep the airway open to make this the transition from breaths to chest compressions faster. So 30 to 2 puffs, non-stop, until the baby wakes up, the AED arrives, the paramedics tell me to stop, or I'm too tired to continue.